Price. I'm a community health paramedic with Austin Travis County EMS, and today we're having a pop-up resource clinic. We designed this service to present resources to those experiencing homelessness in their own community based on the needs. So first you'd come on into the intake table and you'd sit down with one of our community health paramedics who would get your demographics and figure out exactly what resource you needed to be connected to. And then at that point, we would partner you up with a navigator. That navigator is going to stay with you the whole way. They're going to help you figure out exactly what you need to do at each table. So over here, one of our first resources is the VA, and we have agents who are from Front Steps as well as Safe Haven today, and they come every single time. They connect you to case management, and they have wraparound services. Then we have Front Step. They print out a service point card right here on site. You'll need that card to get into the arch and to get services throughout the city. So over here we have map services. They would find out if you're eligible and go ahead and do your application today and print you out a card. And then once you have your card, which is typically the first step, then we'll take you over to the AmBus where we have a full clinic. So in the AmBus we have a provider that does assessments, and also they can prescribe your medication or just fix an ailment that's been bothering you. They would do an intake here down at the end. These are the crew that work street med, mobile med, and in the clinic down at the arch.
Stop.
So Mobile Loaves and Fishes, they're a partner of ours, and they always bring the food truck out. They also have toiletries and some clothes. This way, the people who are working and getting things accomplished at the perk don't have to worry about having to go panhandle or work for the food to eat for lunch. This is a new addition that we have. This is the City of Austin Animal Services. What they do is they do microchip, and they can provide you with supplies such as collars, food, and other things. They're kind of new. They've only been with us a couple of months, but it's worked out really well. In this area, you can address your substance use. You can get counseling. You can do a needle exchange for harm reduction. You can go into treatment, get HIV testing or Hep C testing, and all that's done today on the spot. If you walked in and you had or seeking to get treatment, you can go literally into treatment today. We also have mental health services on site. Over here you can do an intake, you can check in with your case manager, or you can set up an appointment if you've been a recent client. And then we have a special team that we're a part of. It's called the Homeless Outreach Street Team, and it's comprised of Downtown Community Court, Austin EMS, and then we have Integral Care and APD and Court. So if you were to partner up with this team, they would work with you downtown and help you accomplish any interventions that you weren't able to do today. They would follow you where you're staying at your camp. And then lastly, we have what's called a coordinated assessment. You can sit down and answer a set of questions that would give you a rating and determine how eligible you are for housing. Then they would make referrals to each of the agencies that can help you get into housing today. And at that point, you've finished everything. You're going to take your intake form back to us at the table, and we'll give you a bus pass so you can get back to where you need to go. We have been doing these pop-up resource clinics since July of 2017. Our first one was at a Krispy Kreme, and it had about 10 people. And then the next one we had at McDonald's, and there were 30 people, and it's grown to this size. We have had probably 9 to 10. There were a couple months we had to skip due to weather, and then we had the hurricane shelter. But we even did one on the front steps of the arch. So thanks for joining us today and seeing what we're all about. We've created a community to take care of our clients and our patients. We're really proud to be a part of this collaboration with all of these resources in Austin.